Today, we're diving into non-Hodgkin lymphoma, a term that encompasses a diverse group of blood cancers affecting the lymphatic system. To understand this condition, let's start with the basics. The lymphatic system is a crucial part of our immune system, consisting of lymph nodes, spleen, thymus, and bone marrow. It plays a pivotal role in fighting infections and diseases. Non-Hodgkin lymphoma, or NHL, arises when the lymphocytes, which are a type of white blood cell, grow uncontrollably and form tumors. NHL can be broadly categorized into two main types: B-cell lymphomas and T-cell lymphomas. B-cell lymphomas are the most common, accounting for about 80% of cases. If we look at data, various subtypes include diffuse large B-cell lymphoma, follicular lymphoma, and mantle cell lymphoma, all of which exhibit distinct behaviors and treatment approaches. T-cell lymphomas, while less common, can also vary significantly, showing a range of aggressive behaviors. The exact cause of non-Hodgkin lymphoma is still not completely understood, but several risk factors have been identified. Age is a significant risk factor, with the incidence of NHL increasing as people get older, particularly in those over 50. Additionally, men are more likely than women to be diagnosed. Other factors include a weakened immune system, which may result from conditions like HIV or medications that suppress immune function. Some infections, such as Epstein-Barr virus and Helicobacter pylori, have also been linked to the development of certain types of lymphomas. Now, moving to the symptoms of non-Hodgkin lymphoma, they can often be vague and may vary widely among individuals. Common symptoms include swollen lymph nodes, often felt as painless lumps in the neck, armpits, or groin. Patients may also experience fever, night sweats, unexplained weight loss, fatigue, and abdominal discomfort. Because these symptoms can be attributed to various other conditions, a prompt consultation with a healthcare professional is crucial for proper diagnosis. Diagnosis typically begins with a physical examination and a thorough review of symptoms, which may lead to imaging tests like X-rays, CT scans, or PET scans to visualize the lymph nodes and other organs. A definitive diagnosis often requires a biopsy, where a sample of lymph node or bone marrow tissue is examined under a microscope to identify cancerous cells. When it comes to treatment, the approach is individualized, depending on the specific type and stage of non-Hodgkin lymphoma. Treatment options may include chemotherapy, radiation therapy, targeted therapy, and immunotherapy, which helps to stimulate the body's immune system to attack cancer cells. In certain cases, a stem cell transplant may be necessary, especially if the lymphoma recurs after initial treatment. One of the significant advancements in the treatment of non-Hodgkin lymphoma is the development of CAR T-cell therapy, a personalized form of immunotherapy that has shown promising results, especially in refractory cases. It works by reprogramming a patient's own T-cells to better recognize and attack cancer cells. Living with non-Hodgkin lymphoma can be challenging, not only physically but emotionally as well. It's essential for patients and their families to seek support, whether through counseling, support groups, or connecting with others who have faced similar challenges. This emotional support can play a vital role in the overall well-being of patients as they navigate their diagnosis and treatment. Research into non-Hodgkin lymphoma is ongoing, with studies focusing on understanding its biology better and identifying new treatment strategies. Participation in clinical trials offers patients access to cutting-edge therapies that may become standard in the future. In summary, non-Hodgkin lymphoma is a complex and varied disease affecting the lymphatic system, with multiple subtypes and treatment options tailored to individual circumstances. Awareness of the symptoms, early detection, and advancements in treatment offer hope for many affected by this condition. If you or someone you know is experiencing symptoms associated with non-Hodgkin lymphoma, do not hesitate to consult a healthcare provider for a thorough evaluation. Thank you for joining me today to learn about non-Hodgkin lymphoma. Stay informed, stay healthy, and take care.